What is myopia? Myopia is commonly known as nearsightedness. Nearsighted people have difficulty seeing objects or people that are far away from them. Myopia results when the light does not focus properly inside the eye because the eyeball itself is either too strong or too long. People with nearsighted prescriptions require glasses or contacts with minus-powered lenses to refocus light inside the eye. This is not the same as lenses found in typical over-the-counter reading glasses, which have plus-powered lenses. At Eye Care Center of Colorado Springs, we take myopia very seriously, and we want you to be aware that myopia has reached epidemic proportions. The highest incidence of myopia occurs in Asian countries, but the US is not far behind. The prevalence of myopia is increasing rapidly, and by the year 2050, we expect the number of cases of myopia to double. Is your child at risk for myopia progression?
There are several factors which can increase a child's risk for high myopia. Those are children with a family history of nearsightedness, children of Asian ethnicity, children who partake in increased near activities such as reading or studying, children who have increased use of mobile devices, and children with a decreased amount of outdoor activities. Myopia can continue to increase in children who wear traditional vision correction such as glasses and contact lenses, as both forms of vision correction cause the image to be formed behind the retina, which tells the eye to continue growing for a clear image and therefore worsens the prescription. Higher levels of myopia increase the risk for ocular disease. For a person who reaches the prescription of -3, there is a 3 times greater risk for cataracts, a 4 times greater risk for glaucoma, and a 10 times greater risk for retinal detachments. The risk for retinal detachments increases to 16 times more likely for people who reach a prescription of -6. Our goal with myopia control is to slow the progression of myopia. Unfortunately, there's no cure for myopia, but we have been very successful in minimizing the effects of this disease at the Eye Care Center of Colorado Springs. Many children can benefit from myopia control starting at just 6 years old.
Now let's talk a little bit about how we treat myopia and how myopia control devices work. In the slide before you, you see there's 3 different techniques listed. The first 2 are optical techniques, ways that we use lenses to help control myopia, and the third is a medication technique. Now let's talk about these optical techniques. In the slide before you, you see a diagram of an eye that is uncorrected, a myopic eye without correction. In the diagram on the left, the image shell, the place where light is focused upon the eye, is shown. The horizontal arrow represents the central vision, and you can see that the image shell lies in front of the retina. That means that the image now in the distance is blurry. But we've learned with myopia that a lot of why myopia progresses and changes is because of what's occurring in the peripheral vision, what we call peripheral defocus. So if you look at the arrows that are moving upward towards the peripheral retina, you can see now that the image shell has moved behind the retina. That creates a condition that we call hyperopic defocus. Hyperopic defocus is the stimulus the eye receives, the signal the eye receives to continue to elongate and grow longer, and that's why traditional lenses and traditional eyeglasses are ineffective at treating myopia. If you look at the center image, you'll see this very same eye now that we've corrected with a traditional spectacle or contact lens. The horizontal arrow representing the central vision is now focused directly upon the retina, so everything is clear in the distance, and we're happy that we can see clearly far away. But if you look at what's happening in the periphery, in the peripheral defocus, we've even moved the image further behind the retina, creating a greater amount of hyperopic defocus. We've actually increased that signal to the eye to continue to elongate and become more myopic. So what's the ideal? How would we like to change that image shell to reduce the likelihood of myopic progression? That's the image on the right. You can see in that image that the central focus, or the horizontal arrow, is still touching the retina, so things are still clear in the distance. But in the periphery, in the arrows moving upward, now we've moved the image shell in front of the retina, we've created myopic defocus. And myopic defocus doesn't send that same signal to the eye to continue to elongate. So the optical devices we use to treat progressive myopia will change the image shell, the light focused upon the peripheral retina, and reduce the tendency for the eye to become more and more myopic over time. Among the treatments that we use for myopia control, at Eye Care Center, we believe that corneal reshaping is probably the most effective, easiest to control, and gives us the greatest amount of myopia control of the various techniques. We use them all. We use all three of these techniques in our practice. And when you come in for your examination, we'll really help you determine what your individual needs are and what treatment will be most effective for you. The interesting thing about corneal reshaping is that it's a contact lens that's only worn during sleep. So the lens is inserted at night and it's removed in the morning. During the day, the vision is clear in the distance, and we've changed the optics of the eye. We've reshaped the eye in order to create myopic defocus in the peripheral retina, and therefore we can slow myopic progression using this lens. Soft multifocal contact lenses have similar optics to what we can achieve with corneal reshaping. There is perhaps less control over how much myopic peripheral defocus we can create with a soft contact lens, but for some patients, a soft lens is still the best choice. Atropine is a prescription eye drop that can slow myopic progression. Although we don't know the exact mechanism behind how this drug works, it has been shown in research to slow myopic progression as well. When you come in for your examination or bring your family members in, we'll spend time with you to help you determine which treatment would be best, which treatment would be safest and most effective for you. We really believe that it's our duty and our mission at Eye Care Center of Colorado Springs to try to reduce the risk of eye health problems for every one of our patients for their lifetime. We appreciate you spending time with us today, and we hope to see you soon.